advocacy attitudes towards patients. And most of all, the emphasis in this country is on cultural competence. That's from a accreditation perspective as well as a practice perspective.
Hi, Dr. Clark. Can you tell me a little bit about yourself and how you got started in the field of global health?
Yes, I've been interested in it for a number of years. I think it sometimes starts from your own personal background. At least that's the case with me. I grew up where my mother used to always, she never traveled. She was a person who never traveled. So I remember the first time I wanted to leave the country, she got all upset and thinking I was going to, all she could think about was whatever she saw on television that was negative, like a war going on in another country. She figured that was any country you went into because she didn't know any better. And so she would try to talk me out of it, but it just made my curiosity even more. And so then when I began to get students, my first experience was getting students coming to work with me from France. And after working with them, I began to become more interested and wanted to go and visit with their country like they came to visit with mine. And I eventually did that about a year or so later. I started first traveling to the countries to give presentations. So my participation was mostly in professional associations and giving posters, and then eventually it became platform presentations. And that really got me started. So after that, students started requesting to come from Spain, from Italy, and I later left that job from a pharmacy practice perspective and got into academia. And now my interest is still there in trying to basically help our students get as much experience as they can by participating in global health experiences.
Awesome. Thank you for sharing. Why is global health important?
Well, it's important for a number of reasons. As I look at it, I think about the importance of it to what may be their practice in our country. Oftentimes, students will visit another country and they learn some of the difficulties in that country. But what it also does is helps them apply those experiences to things that are going on in their current country where they would likely be setting up their own practice for most of their career. So one big benefit from the perspective I'm looking at it anyway is that it helps build skills, knowledge, advocacy attitudes towards patients, and most of all, the emphasis in this country is on cultural competence. That's from a accreditation perspective as well as a practice perspective. So those types of experiences in another country helps in us achieving those goals related to cultural competence, advocacy for patients who may need care the most by getting those experiences from another country. Because the data has shown that students do become more sensitive. They develop a certain awareness about things that they did not have, and the goal is that they would apply those things to their current practice.
Okay. And my final question today is, what kind of global health efforts were you involved with before the pandemic started?
Most of my efforts have been involved with education, and that has been from giving presentations in other countries as well as now helping with students to get experiences in other countries. I have not been able to set up some of the more patient-related practices that I wished I could possibly do, but not so sure that can happen. And so those are the main two things. And we continue to build collaborative relationships with countries all throughout the globe. Our school is very young, so we're not as old as some programs who now have students going anywhere in the whole country, the whole world. We are somewhat limited to about 4 or 5 countries right now, but that is just because we are very young, a young school. I expect that as we get older, then those things will expand. So my big effort now is focusing on trying to build the capacity for students to have experiences throughout the country. I think locating the sites is one thing, but the biggest issue is the money that they will need to help them travel to those countries when they start taking those courses. Because I don't think we will have trouble finding enough students wanting to go. It's a matter of whether we can support them in going to those places. So I'm focusing a lot on trying to work with our campus offices here because they allow opportunities for us to collaborate with another division within the college where we can sort of collaborate with them to work in a country that may be welcoming us there when it comes to us trying to provide services for those countries. So those are the basic things that I've been involved with for the most part.
Well, thank you so much for sharing your experiences, Dr. Clark.
All right, you're welcome.
Thank you.